Hello, welcome to Health Matters. I'm Vivian Irikefe. For decades, a large part of Africa has been plagued with poverty and diseases, but the continent now has another problem to deal with: obesity. With civilization and unbridled lifestyle changes, the number of overweight Africans is growing rapidly and opening up a whole new set of problems. Social critics argue that unchecked habits are largely responsible for the increasing waistline among Africans. According to the World Health Organization, in sub-Saharan Africa, 23% of adult men and 30% of adult women are obese, and the expectations are that in the next 20 years, these numbers will double. The continent now contends, on one hand, with issues bordering on malnutrition and famine caused by economic and political factors, but also, on the other hand, a growing number of overweight and obese people influenced by social factors. Today, TVC News Health Matters examines Africa's growing obesity problem and its health implications. We would also bring you latest health news, how to keep fit in a stress-free manner. All these and more after this report. Stay with us.
An obesity epidemic is not the first thing that comes to mind when thinking about health problems in Africa. You're far more likely to associate the region with infectious diseases like HIV and malaria, or starvation and malnutrition. But the last 2 decades have seen dramatic increase in obesity in sub-Saharan Africa. In South Africa alone, 64% of the black population and 50% of the white population are overweight or obese, according to a study by the International Association for the Study of Obesity. The Ugandan Heart Institute predicts that obesity-related heart disease will be the leading cause of death in sub-Saharan Africa by 2020. Complicating the picture are social attitudes that make being overweight seem harmless, if not explicitly attractive. This is not to say that no one is starving anymore in Africa. This region may have started to experience what's called a double burden, with malnutrition on one hand and the growing prevalence of obesity on the other. Overweight and obesity result from an energy imbalance. The body needs a certain amount of energy or calories from food to keep up basic life functions. Body weight tends to remain the same when the number of calories eaten equals the number of calories the body uses or burns. Over time, when people eat and drink more calories than they burn, the energy balance tips toward weight gain, overweight and obesity. Once considered a high-income country problem, overweight and obesity are now on the rise in low and middle-income countries, particularly in urban settings. Urbanization has occurred rapidly and has been accompanied by new technologies that promote sedentary lifestyles. Due to accessibility of private cars, television, and household appliances, the population as a whole is engaging in less physical activity. The rise in caloric and fat intake in a region where exercise is not a defining part of the culture has added to the overall increased percentages of overweight and obese populations. What we choose to eat play a large role in determining our risk of gaining too much weight. But our choices are shaped by the complex world in which we live. For children, this risk is often determined by the kinds of food parents make available at home. For youth and adults, it may be determined by how far we live from the nearest fast food restaurant. In many parts of the world, the so-called food environment, the physical and social surroundings that influence what we eat, makes it far too hard to choose healthy foods and all too easy to choose unhealthy foods. Some even call this food environment toxic because of the way it corrodes healthy lifestyles and promotes obesity. Foods such as vegetables, fruits, and whole grains are more expensive than less healthy foods such as refined grains and sweets, and may be too expensive for low-income families. Another factor is time. It takes longer time to prepare healthful meals than to buy convenience foods or fast food. According to the World Health Organization (WHO), overweight and obesity are the fifth leading risk for global deaths. At least 2.8 million adults die each year as a result of being overweight or obese. In addition, 44% of diabetes burden, 23% of the ischemic heart disease burden, and between 7 and 41% of certain cancer burdens are attributable to overweight and obesity. Experts believe if the current trends continue by 2015, approximately 2.3 billion adults will be overweight and more than 700 million will be obese. The scale of the obesity problem has a number of serious consequences for individuals and government health systems. Understanding how the food environment influences our weight can help policymakers identify ways to change the environment and in turn reduce obesity risk for everyone. And it may help address one of the more troubling trends in the obesity epidemic. Although there is no single cause of overweight and obesity, eating fast food has been shown to increase caloric intake and the risk of becoming obese. Experts are of the opinion there is no single environmental change that would halt the rise in obesity and related health problems. Instead, improving the food environment will require concerted work across the wide range of sectors and settings, from government and industry to local institutions and families.
Obesity and its associated health problems have a significant economic impact on health systems, and the medical costs associated with overweight and obesity have both direct and indirect costs. Toyin Abo looks at the causative factors for this trend in Africa.
Thank you, Vivian. Today on Bus Stop segment, we are taking people's view on why more Africans are getting obese.
You know, we have to know the type of food we eat that doesn't contain a lot of cholesterol and other things. We need to read books. We need to know our system and know the type of food we take so that we'll be able to slim down and not get too fat.
Lack of exercise. In this part of the world, we don't exercise ourselves. That is one principal reason why people are getting fatter. Two, we don't watch what we eat. We just put anything into our body. We accumulate much of cholesterol so we eat fatty food in this part of the world than any other food. I think that is one or two of the major reasons why people get fatter and fatter. Also, it has to do also with attitude. People think the fatter you are, the richer you are. So people tend to develop that attitude towards getting fatter so that people will give them that respect in the society that they have money. So, but that is not the case.
Because most of our food contains a lot of fat. Even carbohydrates is fat.
Because of the level of poverty, no balanced diet, carbohydrate and all that and all.
Well, fat or obese, people have expressed their views on why they think Africans are getting fatter. Back to you, Vivian, in the studio.
For a more critical look on causes, consequences, and health risks of obesity in Africa, Habiba Basonya speaks with an expert.
Thank you, Vivian. We're glad to have you with us on the interview with expert segment of Health Matters. Today, we are discussing the fact that many Africans are gaining weight excessively. We're going to be talking about obesity, and at this point, I'm being joined by a medical doctor, Olujimi Shodiko. You're welcome to the show.
Thank you very much. It's nice to be here.
Yes, we do know that a lot of studies have related obesity with springing up of fast food joints and restaurants across the globe. Is this related in any way?
Yes, thank you. Well, obesity is becoming a very serious problem in Africa. It has led to an increase in the number of non-communicable diseases that we are seeing in Africa. And medical experts have tried to find out what could be responsible for it. You mentioned one of them, which is a very important point, the springing up of fast food joints. Now, the problem with fast food joints is not really in the fact that they are fast food joints, but in the type of diets, you know, that they serve to people. A lot of these diets are high calorie diets. A lot of these diets are high fat diets. You know, you have a lot of chicken that are fried with oils. You have a lot of baked products, you know, with a lot of cholesterol. So it's becoming a big problem, and people are now shying away from the traditional meals that we've had in the past. Vegetables, you know, the cereals, which could actually help, you know, the general health, yes, of an individual. Secondly, we've also had a change in our lifestyle. Traditionally, we've always had to walk long distances. You know, we've had to do things manually.
Okay, then what is responsible for the growing number of obese people in Africa?
Well, other factors that could be responsible are, well, there's always the genetic factor that comes into, you know, any medical condition, and that's also there. But I think generally it's just the issue of westernization, and that's why we're trying to get back to the past. The first thing that we've been trying to advise is the issue of lifestyle modification. Lifestyle modification, talking about, one, our diets. You know, nobody is saying that once in a while people shouldn't get into the fast food joints to grab something to eat, but it shouldn't be morning, afternoon, night, evening. Before you know it, you know, one is taking so much calories and is not able to expend it. Secondly, even if one were to go to some of these fast food joints, the advice is also to eat some vegetables. Some of them have some vegetable packs and co, you know, that people could take instead of just taking traditional chicken, fried chips and things like that. So that's on the issue of diet. Also, on the issue of lifestyle, it's advised that every individual should have at least 30 minutes, you know, of brisk walking in a day. The biggest problem that occurs is over time there's an accumulation of fat in vital areas, especially in the abdomen. You know, you have this truncal obesity, and then obesity now affects all other parts of the body. If we were to go from system to system, you know, starting from the central nervous system, going to the heart, the common things that we know, hypertension, things like diabetes, you know, things like cancers are all coming up because people are not exercising enough. So you find, even in establishments where people have to be in the office for long periods of time, there has to be a policy where, you know, maybe there's a gym somewhere there where people could just take 10 minutes. Also, some institutions and some establishments have started introducing laws that, okay, once you've sat down for about 2-3 hours, just take a walk. You don't need to walk outside the building. You could just walk around, you know, the table, just, you know, just to exercise. Yes, exercise energy, and then be able to, you know, burn off some calories.
Okay, so what advice do you have for people as regards their diets, what to eat, when to eat, and how to eat?
Okay, well, first and foremost, I think I'll start with when food should be taken in, because most of our energy is expended during the day. It's always been advised that we should take in heavy meals as breakfast, not necessarily lunch, but most times as breakfast, because after that you're going to expend a lot of energy. You're going to, you know, have other issues that you're going to face throughout the day. The problem that we have is that because of our work, a lot of people's working environments, people have to live, for example, in a city like Lagos in Nigeria, you know, people have to leave their houses very early in the morning and come back very late at night. So most people get to now eat their heaviest meal at night, just before going to bed. So they are not able to expend that energy. That energy is just whatever calories they've taken are deposited as fat in different parts of the body, and now that increases their chances of being obese. So you could even see someone that says, I work long periods I work 16 hours a day.
And yet
the person is still obese. So why am I obese? It's because of the time that the person is eating. Secondly, the issue of what we take in. Again, people, because someone may not necessarily eat 3 square meals a day, the person feels the only meal I should take should be a very heavy meal. It now becomes a problem because maybe, you know, at night a person hasn't eaten all day, says, okay, let me take 3 pieces of chicken, let me take 2 bottles of Coke just to compensate for all the years, which again is a problem because the body already has some counter-regulatory mechanisms when one is not eating. So by the time you now take an excess, it now ends up being deposited as fat. So it's a very big issue. People should try as much as possible to reduce their calorie intake, reduce their fat intake. If one is going to take in, you know, things like oil that are used to fry, it's better to use, you know, non-saturated oils.
Yes.
And there are some of them that are now being labeled as low cholesterol oils. So people could use that to cook, people could use that to fry things. That reduces the amount of cholesterol that is deposited in the body. Then secondly, we also advise that if one were to, you know, one should try and take healthy sources of protein. Things like fish, you know, things like we should avoid red meat. Of course, we can't stop red meat, but as much as possible, as people grow older, they should avoid the amount of red meat that they eat. If they're going to eat chicken, they should try and remove the skin, you know, because the skin has the highest amount of fat deposits in chicken. And then when they something like turkey too has a high amount of fat deposits, very oily. So, you know, as much as possible, the skin should be removed and then the flesh can be eaten.
All right, thank you very much, Doctor, for coming up on the show. I've been speaking with a medical doctor. He is Olujimi Shodikwo, and he's been talking about the fact that many Africans are indeed gaining weight excessively. We've been talking about obesity, and he's talked so much about what can be done to curb the situation in order not to arrive at a pandemic situation. That's it on this edition. Thanks for joining us.
You're still watching Health Matters. Still to come, health news, fitness, and Ask the Doctor right after the break. Stay with us. Welcome back. Up next on the program is the health news.
A new United Nations report has revealed that antiretroviral treatment in Africa has increased from less than 1 million to 7.1 million over 7 years. The executive director of the joint UN program on HIV and AIDS, UNAIDS, Michael Sidibe, says Africa has been relentless in its quest to turn the AIDS epidemic around. Sidibe stresses that the UNAIDS update on Africa attributes this success to strong leadership in shared responsibility on the continent and among the global community.
We have been showing that we can produce results. We have been demonstrating that we can increase the coverage, and we have science evidence today which can show us that we can even reduce significantly the number of new infections if we put people early on treatment. But what we need is to sustain those results.
The report also states that 16 countries in Africa's east, west, and southern regions have now ensured that more than 3/4 of pregnant women living with HIV and AIDS receive antiretroviral medicine to prevent transmission to their child. At this year's summit, AIDS Watch Africa, a platform for advocacy and accountability for the responses to AIDS, tuberculosis, and malaria founded by African leaders in 2001, reviewed progress on health governance, financing, and access to quality medicines, amongst other areas, and measure whether national, regional, continental, and global stakeholders have met their commitments. The AU, UNAIDS, and the New Partnership for Africa's Development, NEPAD, will also launch the first accountability report on the AU-G8 partnership, focusing on progress towards ending AIDS, tuberculosis, and malaria in Africa. United Nations report coming from Somalia has indicated that almost 260,000 Somalians, half of them children, died of dire hunger from 2010 to 2013, a toll that is greatly higher than they feared at the time. United Nations officials admitted they could have done more to prepare for the famine, stating that half of those who died were children aged below 5, with almost a fifth of that age group dying in the hardest hit area. United Nations Humanitarian Coordinator for Somalia, Felipe Lazarani, said the report confirms United Nations and the Somali government should have done more public enlightenment program before the famine was declared. The famine was first declared in July 2012 in Somalia's southern Bakool and lower Shabelle regions, but later spread to other areas, including middle Shabelle, Afgoye, and inside camps for displaced people in war-ravaged Mogadishu. Somalia, ravaged by nearly uninterrupted civil war for the past 2 decades, is one of the most dangerous places in the world for aid workers and one of the regions that needs them most. Kenya police say they are searching for 40 mentally ill patients who escaped from the country's only public psychiatric facility. Samuel Amanpiu, the police chief in charge of the area where Mathare Mental Hospital sits, said that about 70 male patients overpowered the guards at the hospital and that about 40 managed to escape. Anampiu says the escapees had earlier complained that the drugs they were being given are ineffective. Mental health care in Kenya suffers from a lack of funding, poverty, a lack of access, and the stigma associated with mental disorders prevents many patients from getting good assistance.
Lack of activity destroys the good condition of every human being, while movement and methodical physical exercise can save and preserve. Enjoy our workout section. In our question and answer session with Dr. Martins Djembe, viewers across Africa have the opportunity to send in their questions and get expert advice on medical conditions affecting them.
Yeah, if you have a tender ball below your ear, that could be a lymph node. That may be as a result of certain infections you have. The lymph nodes, nodules that are collection points, and they help to fight infections and the rest. So if you have a lymph node may signify that there is a problem somewhere. It could also be a lipoma or a sebaceous cyst. It could be anything. So you must present this to a doctor to do a physical examination and certify that it is a lymph node, a cyst, or a lipoma, or whatever. There are so many things that can occur under the earlobe. It depends at what stage of pregnancy this person asking the question is in. During the first trimester, if you have pain in the lower abdomen, it means that the womb is now getting enlarged and it's growing possibly out of the pelvic cavity. And the ligaments that are attached to the womb also stretch, and you can get such cramps or pain in the lower abdomen at the first trimester. Now, after the first trimester, such pains might not be attributed to what we call Braxton Hicks contractions. These are physiological contractions of the womb, simulating when labor will come or when baby moves and all that. So the womb tends to contract and more or less expand and contract, expand and contract, and you feel such a pain. Not excruciating, not so severe, but it's a normal physiological change of pains in pregnancy. That will depend on what the doctor says. That will also depend on the age of the person asking this question. We have insulin resistance type 1 diabetes, we have type 2 diabetes, and we have, of course, gestational diabetes. So we don't even know if it's a woman asking this question or a man asking this question or a pregnant woman. So if it is due to insulin deficiency or insulin resistance, we'll categorize it depending on the blood level of sugar and other tests that we might perform. So it is not easy to say if your diabetes is type 1 or type 2 without us seeing you or without a doctor seeing you.
And that's all on this edition of the program. For your questions and concerns, write us at healthmatters@tvcontinental.tv, and our in-house doctor will surely respond to them. Until next time, I'm Vivian Irikefe. Thank you so much for watching. Stay healthy.